All right, hello everybody. Thank you for joining us. I hope you're all staying well and healthy. I am Pascaline Dupart, the faculty director of the King Center and a professor in the Department of Economics here at Stanford. I will be moderating this special event on COVID-19 in Africa. Just so that everybody knows, this event is being recorded. We will put the recording on our website, the King Center's website, early next week. The event is hosted by the Stanford King Center on Global Development and the Stanford Center for Innovation in Global Health. So let me start with just a few points about what these two centers do. The King Center is dedicated to stimulating research to alleviate global poverty and inform policy on critical development issues. We do that by supporting faculty research, supporting students' opportunities. And over the past 4 months, we have been hosting a series of webinars on the impact of COVID. We had one on China, one on India, one on Latin America, and this is the fourth one on Africa. The other center co-hosting is the Center for Innovation in Global Health, which is essentially the hub at Stanford for all things global health. It's led by Senior Associate Dean Michelle Berry. It has three strategic areas: human and planetary health, 21st century leadership, and global health equity. And in this era of COVID, it has been very active, and in particular, sharing a newsletter series and also a series of webinars and educational offerings related to COVID-19, as well as seed funding for COVID-19 research. So today we are here to discuss the impact of COVID-19 in the Africa region, and we have a fantastic panel. To do that, I'm very excited to welcome our three panelists. Let me introduce them briefly. You can see their pictures on the slide, but you can also see them semi-live on the Zoom little videos. We have in alphabetical order Professor Belinda Archibong from Barnard College at Columbia University. Professor Archibong teaches economics, and she studies a broad range of issues from gender gap to the environment, with a focus on the Africa region. And she's here today because she has done a lot of work on epidemics. And so she will share with us some lessons with us from her work on past epidemics in the Africa region. We also have Professor Agnes Binagwao. Professor Binagwao joins us from Kigali in Rwanda. She's a pediatrician by training. She's currently the Vice Chancellor of the University of Global Health Equity, and she was formerly the Minister of Health in Rwanda. As I mentioned, she joins from Kigali, where it's already late in the evening, so we're extremely grateful that she has agreed to be with us today, I should say tonight. And our third eminent panelist is Dr. Albert Zoifat from the World Bank. He's the chief economist for the Africa region at the World Bank and has been in this position for quite a while. He's been at the World Bank for 23 years. He's a macroeconomist by training, and I suspect that he has spent a number of sleepless nights over the past 6 months paying very close attention to the economic impacts of the COVID crisis on the continent, and thinking about what the World Bank and others and governments can do and should do in response. And so we are eager to hear from him today. So I'm really thrilled to have all of you on the panel. Thank you so much for taking the time to be with us. I know it's very, very busy for everyone. And it's really wonderful to be able to hear your insights. Here's how we're going to proceed. I'll give a few introductory remarks. Then each panelist will have 5 to 10 minutes to present. And after that, we'll start the Q&A, which I will moderate. So thank you very much to those of you who already sent questions at the time you registered for the event. If you have new questions that come up as you listen to our panelists, please use the Q&A feature to ask your question. Those will be related to me, and I will be able to pass them on to the panelists during the Q&A session. So, in way of introduction, let me just start by reminding everyone that Africa is a very large continent. Okay? It's the second largest in the world. It covers 20% of the land area of our planet and hosts 16% of the world population. That's just about 1.3 billion people. It is also the continent with the largest number of different countries, 54 sovereign entities, with a lot of historical and cultural differences. So this is really a huge task that has befallen us on this panel, because we have only 1 hour to talk about the impact of a huge crisis on a huge continent. So in advance, we apologize if we don't do justice to all of the issues that need to be discussed, but we're going to try to give it our best shots. And let me start with actually some good news, if I may say. The good news is that Africa has mostly beat COVID, because this map shows you the total confirmed COVID-19 deaths per million people as of just a few days ago. And clearly you see that the African continent stands out as being very light in a sense that it had very fewer deaths than the rest of the world. The one country in sub-Saharan Africa that has been the most affected is South Africa. And so this has been coined the Africa puzzle. Why are the African continents being mostly spared by the crisis? And some folks have been saying, well, this is just undercounting. Actually, the continent is not doing that well. It's just that it's not well monitored. I think that's something we can maybe dismiss to some extent, and I'm sure that Professor Benagwa will tell us more about that. But it seems to me that there's no evidence of massive excess mortality or hospitals overflowing. So I think it's not an undercounting issue. It's really more that there has not been as much health problems from the crisis. So then another potential explanation would be biological. Some people have said, well, the continent is much younger, and you can see this from these visuals. The median age of the population is 18 on the African continent compared to 35 in North America, or even older than that in Europe. And so a younger population, even if they are infected, may be dying at much lower rates. Others have argued that there may be some form of immunity stemming from prior exposures to other coronaviruses, or maybe the fact that the body has to deal with malaria on a regular basis, and that may prepare people to COVID. Another possible explanation is that Africa did not get exposed to the virus as much initially. There are fewer international travelers coming in Africa. This graph shows you essentially the share of the world traffic, and you can see Africa is a very small part of it. And so maybe by the time the international community realized there was really a problem, the actual stock of people infected with the virus in Africa may have been very low, and so that meant that the rapid response was especially effective. And in fact, that may be the most likely explanation for why Africa has been doing so well, which is that it actually had a very fast policy response, and one could argue maybe a better policy response than other continents. The lockdowns that we saw, I was in France at the time, and we were on lockdown, quite severe lockdown. Many other countries had similar lockdowns. Well, many African countries adopted very quickly similar policies. Africa also had experience with contact tracing from their exposures to Ebola. Some have argued that there was very high levels of cooperation among countries through, in particular, the Africa CDC, very high compliance with mask wearing among the population. And so it could very well be that this is the true reason why the continent has been doing so well. There's just one puzzle then that we can throw to this is the fact that Tanzania seems to have been doing quite well as well in terms of few deaths, and yet it seems like this is a country where the leadership did not fully embrace this type of rapid response. And so these are all questions that I have that I'm sure Professor Binagwa will be able to answer and discuss. But this good news in terms of the health effects is somewhat counterbalanced by potentially bad news, which is that even though there is not that many COVID cases, it seems like COVID disrupted everything nevertheless. And what this graph shows you is using the Google mobility data. It just shows you that right around the end of March, throughout the sub-Saharan Africa, and I showed you the different sections of the continent in different colors, there was a massive drop in mobility. This is measured as like how many people are passing through, bus stations and things like that. And I put South Africa separately since it was affected so much more. And you see that it had a very strict, lockdown. And up to this day, most of the countries in sub-Saharan Africa have not gone back to the normal level. You see, we are not yet back at zero, okay? And this is all the more, striking that this happened essentially at the same time as in other countries. So the France here, I added France in some French, is a blue line. So France, introduced a lockdown maybe a little bit earlier than every everyone on this graph. And then the US is the orange line. That, the US actually did not do as strict a lockdown as, it was very heterogeneous across states. And so many countries in Africa did, an even more severe reaction than the US, even though, they had essentially, very, very few cases at the time. So there's this very rapid reaction, very early on, which could have led to stemming the disease. But then, obviously it had economic impacts that we will hear from, especially from Albert. Then this may lead to other ways through which the disease could have been deadly. Some have argued that this may have stemmed a lot of efforts in terms of preventing other diseases to spread. Maybe the efforts towards dealing with HIV, TB, malaria, routine immunization have been stalled because of the restrictions on activities. Obviously, loss of income, increase in food insecurity. A lot of kids are out of school. Schools have been closed in most of the continents. There's like a number of issues there. It's much harder to do remote learning if many people are not connected through the internet. In some countries, they've gone all in and decided that the year was canceled. So Kenya canceled the 2020 school year. Ghana decided to push off the start of the school year to January instead of September. And so there may be consequences on the new next generation that will be long-lasting if it's not possible to remedy that. And so these are important things to think about. Obviously, the economic slowdown worldwide, decline in export prices is going to hit Africa and the global recession. So these are, a lot of the question that I hope we'll explore in the panel, what explains Africa's relative success in averting COVID-19 death. What do we know about the magnitude of the human and economic impacts that I just described from the measure that had to be taken? And importantly, what does the road to discovery look like? And what role for global institutions like the WHO, like the World Bank, what do we know from previous epidemics that can be useful? So with that said, I'm going to start with our panel, and we are going to start with Professor Agnes Binagwaho. For those of you who joined us late, let me just remind you, she's a pediatrician in training, currently the Vice Chancellor of the University of Global Health Equity, and former Minister of Health in Rwanda. I'll stop sharing my screen now. Professor Binagwaho, the floor is yours. Thank you again so much for being here.
So thank you for your introduction and for what you have presented for Rwanda. My main objective will be to discuss the impact of COVID-19 on health outcome and health system in sub-Saharan Africa, but I will compare also to the US and to Europe, and also talk about the contributors to the pandemic response in Africa. This second slide shows you first what is the status of COVID-19 cases in Africa compared to Europe. You can see that Africa is on the top, the green on the top of all those curves, and you can see that Africa has very little cases compared to the other continents. Same for death. You can see on top here in orange that the contribution of Africa is the smallest. If we compare also the number of deaths to the number of cases, it shows that Africa is also doing better so far. This rate for Africa is 2%, for North America 4%, and 6% for Europe. And see for my country, Rwanda, in the top, in the bottom. And I want to insist that you see Rwanda, you see South Africa, so that for the general population, I don't talk about you, but for the general population, and even the general family of researchers, Africa is one box, and they don't make the difference between countries, South Africa or Rwanda, like they do between Italy and Norway. There is a big impact on the health system in sub-Saharan Africa, but it's across the world. You can see here the photos of in down left, Italy, in top right, New York, and you can see Rwanda on the top left and South Africa down. I just put those photos to just illustrate the impact and how all health systems across the world were overwhelmed. The impact of health workers is also huge due to compromised safety, but it's also across the world. We have 10,000 health workers infected in Africa at the end of July, 160,000 in the US as of yesterday, and in Europe, 150,000 in only 9 countries early July. So this stress is across the world. Worldwide, there is also a disruption of care. You can even see 90% of countries reporting a disruption in services. And you have in England, they say that the postpone of some cancer care will lead to 18,000 deaths. Increase of disparities that were pre-existing, yes. Vaccination and delivery for the poorest, it's a fact. Health system and health workers worldwide were disrupted. There is a shortage of PPE in the US, Europe, and in Africa. But I have to put a point of ethic here. The vulnerable countries have been seeing their procurement goods stolen by powerful countries. And CDC Africa has tried to do a pool procurement with success, but mitigate by the fact that even when they had money, their procurement order were not considered, even if it was posed before the rich countries. There is a disruption in healthcare services, as I said. There is an increase of inequities worldwide. And in Africa, we need to do more studies to know what happened to our minorities. We don't know. In other countries, like in the US, we know that Black people comprise 13% of the population and do 30% of COVID. So there is a disproportionate impact on the Black population. We have an issue, for me, with all what you say, all what I read of the Western supremacy mentality when it's compared to, they talk about Africa. The reason of all African has blocked their border, do the social distancing, order the mask, except Tanzania, I agree, but it's one country out of how many? And as you say, we have met the continent with the biggest number of countries. It was expected that we will have 10 million deaths. And the Global Health Security Index was saying we are a failed continent, we will be wiped out with something like COVID. And the US was marked as the most prepared. So they were totally wrong. We need new metrics and a new way to analyze countries. There is deny, but I want to say that it is in Tanzania or the US, there is a good studies that show that when elections are in the horizon, the behavior against the pandemic, because we need people out to go and vote and campaigning, are different. There is also the North-South paradigm where solutions have to come from the North. The South cannot do better than the North, and a refusal to learn from the South. For Rwanda, I'm going to give the country I know the best. So we learn our contextual factor. Transport across country, no running water everywhere, the spread of the disease, and financial instability. But we had facilitated in Rwanda strong national leadership, a culture of accountability, access to internet, and like mobile money. And we apply immediately the day we had the first case, the 14th of March, even before, 2 months before, when China create the alarm and the outbreak spread in surrounding countries, washing hands before taking buses or going in public area, testing, contact tracing, quarantine, isolation, lockdown, border closing, social distancing, but also focus on truth and cultivate the trust for the population to follow you. And implementation strategies for those evidence-based intervention is the use of data, reading every day what happened new in worldwide, and integrating policies and guidelines by education, the health providers and the population, control the border, continue to control the border, and also a multi-sectorial coordination, a government that works as one. immigration, police, local government, education, and health work together, and maintain a focus on primary care. Also promote innovation, drones, robots to decrease the movement and increase services. Accountability, local leaders and head of village have to be sure that nobody in their village are starving because of the lockdown, when the lockdown was there, or because of the decreasing of capacity to generate money. Strengthen the health sector and focus on equity, provide food, free testing, quarantine, free treatment. It was for all, except for people who just have to test because they want to travel. For the rest, it's free. Doing so, people really abide to the guiding principle and provide financial support. I want to see the next slide because Rwanda is showing a promising health system coverage before COVID. And you can see that during COVID, the delivery in health facilities didn't change. The use of family planning didn't change. So that means this is for the organization we have because COVID centers are not mixed with the ordinary hospitals. And when somebody is sick, you just have a phone call. They come to take you with an ambulances, bring you to do the test and hospitalize you in COVID centers so that you don't risk to spread the infection inside the hospital. Moving forward, we have to continue what to do, but track emerging contextual factors that we don't know and be flexible enough to prepare for any scenario and continue to support the vulnerable. We need also to build partnership inside Africa, but also with the North and the West, but more respectful partnership. And there are great initiatives in that. And also stop politicize the disease and just go for science. We face some challenges in African countries, as you have seen, economic threat for for formal sectors and also for informal sectors. We are going to have an economy contracting with 7% in Africa. But I have read yesterday that the US is about 30. Europe is planned for 11. So it's countrywide. It's worldwide. And we may face difficulties to continue contact tracing and also the limited research capacity for Africa. So this is what I want to share with you. And for the discussion, I can't wait to join you.
Wonderful. Thank you so much for all these insights. I know your slides are in high demand. A number of folks in the Q&A have asked for those, so hopefully you'll be willing to share that, a lot of information. Thank you. We'll now move on to more of the economic impacts. And Dr. Zoifak from the World Bank, please go ahead. The floor is yours.
Thank you very much, Professor Dupas. It's a pleasure to speak at this conference on the impact of COVID on African economies. This presentation is on economic impact of COVID-19 and policy responses in sub-Saharan Africa. And I would start by referring to two publications from which we draw heavily. The first is the World Bank Africa's Pulse, which is our macroeconomic monitoring, the one we published in April, where we actually did the first comprehensive assessment of the impact of COVID on African economies. And I want to highlight that when I say Africa in this presentation is sub-Saharan Africa, which are the 48 of the 54 countries Pascaline has shown earlier. So in this report, we definitely use different models to come to an assessment of that economic impact that I will share with you. The second publication is a chapter that I've just contributed with my colleagues, Calvin, Jofak, and Hassan Dudu, in a book that has just been published on assessing the economic impact of COVID-19 in the world. So in the developing world. So these are the references. Now, let me start by saying I'm extremely happy to see the positive tone this discussion is taking. And I think, we need to celebrate the fact that the very, very pessimistic projections did not materialize in terms of number of cases and death rate. But it's not over yet. It's not over yet. And, when we look at the numbers, you can see this chart, which is September 1st. At September 1st, we can see the number of cases recorded starting to plateau in most of the African countries. And to actually have an idea of how this is a big progress, you should see what they were in June, right? And you could see that, upward trend. And I'm glad to see them plateauing now in Africa. But it's not done yet because we actually haven't started really observing a declining rate in a significant number of African countries. The number of cases is stabilizing, but what is actually quite important to notice is mobility numbers are actually ahead of the curve. While we're not seeing a steep decline yet, we're actually seeing a pickup in mobility data across Africa that is actually letting some specialists, including the CDC, to caution about a potential second wave. So it's important to acknowledge that, so far so good, great, but let's not let our guard down. We should continue wearing masks. We should continue those protective measures and all, all the PPE that we can afford to make sure we then get to a stage where these numbers go down. So let me leave you with a couple of key messages. The first one, I just talk about it. The second one is that while the mortality rate and the contamination rate may not be, as impactful as we had feared, the economic impact of COVID on Africa is going to be huge. Nevertheless, we are projecting that sub-Saharan Africa would enter its first recession, full recession, in 25 years. And, GDP growth is projected to decline, from 2.4% in 2019 to a range of -2% to -5%. And I want to stop on this range because when we did our projections, we decided to, given all the uncertainty, to actually give a range. And when we published our projections in April, we were the most pessimistic numbers across all institutions. And by the way, even the IMF had a number that was more positive than ours, which was quite strange in Washington. But since then, most institutions have actually revised their projections downwards, and most institutions are now in that window of -2% to -5%. Our projections date back to April, and we haven't changed that since. And it's extremely important to notice that it's not just about GDP that will be affected. What we'll see is that, number of African countries would have a severe shock on household welfare. Poverty will increase. Millions more people will be pushed into absolute poverty in Africa as the result of COVID-19. As our economies collectively lose between $37 and $80 billion in output in 2020. So what is even more severe in our assessment is that we are facing a triple crisis in Africa. The health crisis that the previous speaker discussed extensively, translating into an economic crisis. But the third potential crisis, which is really becoming obvious by the day, is a potential food crisis. And that has been exacerbated by a collapse in import. And when you realize Africa as a subcontinent actually imports more than $40 billion of food every year, sudden stop in global trade has definitely led to a real increase in risk of food security. So these are extremely important impacts of this economic crisis and a potential health crisis. Now, a potential food crisis. Now, there's another aspect of it, which is what is happening to the private sector in Africa. I'll come back to that in my presentation. Because we need to make sure we do not allow our already fragile economies to collapse, because entering the crisis, most of our economies were already underperforming. As some of you may know, 3 economies in sub-Saharan Africa, Nigeria, South Africa, and Angola, make up 60% of our GDP. Which means basically countries like Rwanda, Ethiopia, Senegal, Cote d'Ivoire, Ghana, who have been growing extremely fast, cannot actually pull that average up. And our 3 largest economies have been actually underperforming even before COVID hit. So it's going to be a prolonged crisis as we see it. We don't see this as being a sharp V recovery. Growth rate may probably come back faster next year, but the impact on real output will take a couple of years before we are back to where we were in 2019. So this is very important. Now, in terms of policy response, what has happened is we have observed, despite the delay and the late arrival of COVID on the continent, we have observed a kind of copycat approach in a number of African countries. That was the case for policies. It was also the case for reopening. A number of African countries have actually reopened just because Europe reopened. So, and we have actually been arguing that we need a differentiated policy response in Africa to reflect the peculiarity of African economy structure. And one of that peculiarity is informality. And that's the reason why number of African countries could not implement a strict lockdown. Absolutely impossible, given the fact that most people in the informal sector live from hand to mouth, and it wouldn't have been realistic actually to make it happen. And that is certainly one thing that we're continuing to emphasize as countries struggle to reopen. It is important to adopt a differentiated approach to reopening. One extremely important aspect is the fiscal side. The crisis hit, and with it, we had a collapse in commodity prices. Most African countries had budgeted oil, for example, at around $58 per barrel. And by April, the barrel was below $30. That's basically like, you are in a crisis and your salary get divided by 2, and you still have to face all those challenges. So this has been extremely difficult for African countries. And because of that, there were no buffers left, and the fiscal space is just so reduced that African countries would need huge support from the rest of the world. And that support should come through debt relief. The IMF and World Bank have been working with the G20 to implement a debt standstill initiative, where interest payments on debt would be forgiven for a certain period of time, therefore creating that space for countries to actually face the emergency crisis. World Bank and other institutions have been stepping in to provide support, and emergency projects in health and other sectors, human development sectors, critical. And that's essential because most of the loss in gains would come from permanent losses in human capital as fewer kids go back to school, or the quality of education already quite poor may deteriorate further. So all these are essential findings of the two reports that I've mentioned to you. I wouldn't bore you with the details, the technical details of our general equilibrium model, but I will just stop on a couple of slides to illustrate what I just said. If you look at this chart, the impact of COVID in sub-Saharan Africa would be the highest in countries that are metal and mineral resource rich. And oil-rich countries would also be the most affected because of that shock on commodities that I mentioned. If you think of the impacts as to why that impact is going to be so severe, what we see is that most of the growth drivers would be impacted. Consumption will be seriously reduced. Investment would collapse, and even more in what we call here the catastrophic scenario is actually one that soon may reveal to be the normal scenario, whereby the crisis may last throughout 2020. Right? The optimistic scenario was by July we would actually be over it. Obviously, it's not going to happen. So what you see on this chart is basically, and these are the results of that general equilibrium modeling, the impact on household welfare. It's going to be significant, and what you have here in this what you have in this second chart is a third scenario that we have actually included, which is the non-cooperative scenario. The non-cooperative scenario is the catastrophic scenario plus a border closing, basically shutting down trade within African countries. And that leads to the worst impact on growth and household welfare. This has actually led us to suggest to countries in our policy discussion that we treat trade and trade-related workers as essential workers instead of just locking down borders, because non-cooperation would actually be the most damaging to African countries. Now let me just share with you. Yes.
Sorry, Albert. We need to make sure we have time for.
Very good. So. Okay, 1 minute to close here. Just sharing with you the approach the World Bank has taken to advise countries in this crisis, and it has been three-pronged approach. One, focusing on the health situation, preserving lives. Second, on preserving livelihoods, and third, preserving the future, basically supporting firms in the second pillar, and in the third, sowing the seeds for recovery. And early lessons from this crisis, to conclude, the first is the digital is not a luxury for Africa. Coming into COVID, few development experts were still wondering if the digital is not too expensive or too such a luxury good for Africa. Clearly not. Second, global value chains are in question. Integrating global value chain has been the driver of growth for most developing countries in the past 50 years. We need to reinterrogate those and start thinking or focusing on region building and really intensifying regional value chains in Africa. Third is the heavy dependence on food imports. We clearly have the potential in Africa not only to feed ourselves, but to feed the world. But agricultural productivity has remained one of the lowest in the world and has remained that low for the past 40 years. Something has to be done there. And, last point I would probably want to end on is this notion that education and health are social sectors is one I've been really pushing back on. What is social about human capital? It is about investment, it's about productivity, it's about growth. So it is really about time that our governments in Africa really put enough emphasis in investing in human capital not as a social sector, but as a driver of future growth. Last but not least, let's think twice when we borrow, because we have been borrowing with a lot of sorrow as this crisis has established that. Thank you.
Thank you very much. I'll ask you to stop sharing your slides, and then we'll move on to our third panelist, Professor Archibong from Columbia University.
Thank you very much, Pascaline. So everybody can hopefully see that. Okay.
Wonderful.
Excellent. All right. So I'm gonna time myself, so I'll keep myself within this 5 to 8 minutes. Pascaline will be pithy, so we have time for questions. So I'm just gonna provide some lessons from past epidemics. As Pascaline mentioned earlier, my work is on the economics of epidemics, part of my research. And what we kind of learn is that there are three key points that come out of thinking about the success cases in Africa, right? So how have African countries that have had this history of dealing with epidemics, how have they dealt with them successfully in the past? And what are some lessons that we can learn? So one, I'm gonna talk about health financing, and this is key. And thinking about, Albert mentioned the kind of like the role of external spending and donor spending in health is somewhat outsized in Africa, and I'll show you some statistics on that. Two, thinking about domestic governance and response. So now I think everybody is very familiar with this lingo on contact tracing, testing, and supported isolation. So, many African countries have been very successful in implementing these things for years. And three, about building trust. So a lot of, the kind of response to epidemics and trying to prevent future disease outbreaks has to do with, making sure people take up vaccination, making sure that people trust in their government institutions enough to take up vaccination. So I'll show you some evidence from research that we've done on these things. So just to kind of start out on the health financing. So this is the picture of health financing by region, the most recent data from 2017 from the World Bank. If you look at kind of across a number of categories, so government spending on health as a percentage of GDP, in Africa it's about 5%, very similar to Asia, South Asia, but lower than the world average of about 7%. Same thing with government spending on health, it's really low compared to the rest of the world. So in Africa, again, it's about 7% compared to, so similar to South Asia, lower than the rest of the world, which is around 10%, and lower than the Latin American and Caribbean average of about 12%. When you look at out-of-pocket spending, people are spending much more in terms of like out-of-pocket expenses on health as a percentage of total health spending. In Africa, it's something like almost 40% compared to the rest of the world, which is about 19%. So if you look at compares Africa, and this is the entire African continent, it compares very similarly to kind of South Asian countries on everything except this out-of-pocket spending. But kind of one category stands out, and this is the share of donor spending in total health spending in African countries, right? So this is African countries. So health spending, external health spending, so donor spending on health as a percentage of total health spending is about 20% in Africa, compared to what, like 0.2% in the world, and just like much higher than any other region, South Asia, Latin America, and Caribbean. So this has real implications for then when it comes to kind of epidemic response. And specifically, this kind of slightly motivated our research. We've been doing this work on meningitis epidemics for years. And meningitis is one of these diseases, infection of the lining of the brain. It's really nasty, death, pain, disability. And it's one of these diseases that affects about 23 countries in the African meningitis belt. They are frequently exposed to these epidemics. So a lot of countries kind of have experience dealing with this. So we wanted to understand, like, what is the implication of that chart I just showed you? That you have such a high share of health spending, right? 20% coming from external sources. How does that then affect how kind of the role of global governance institutions like the WHO or the World Bank in helping to mitigate response to epidemics? So what we did was to say, like, let's examine epidemics in this meningitis belt in 23 countries from Senegal to Ethiopia, 700 million people frequently exposed to epidemics. And let's see what happens when you have, these like sudden high exposure to disease, to meningitis, and the kind of national level doesn't rise to epidemic levels. So the way it works is that the WHO declares an epidemic only if the national level of cases rises to 100 per 100,000 population. So think of it like you as a district within Nigeria, for instance, right, where I'm from. can be experiencing super high levels of disease, like unexpected high levels of meningitis. However, nationally, the level does not rise to epidemic levels, so as defined by the WHO, so they don't declare an epidemic. So what happens is that if you have these like high unexpected levels of disease and the WHO does not declare an epidemic year because you don't rise that national 100 cases per 100,000 population, you see these huge declines in economic activity. So think of this as per capita, like per capita GDP. You see huge declines in kind of child health outcomes. So there are more stunted children, this is this dark bar, and more underweight children as well, right? When if your national level kind of rises to epidemic levels as defined by the WHO, really surprising reversal of the effects, right? So in those cases where you have this high burden of disease, but in that year, the WHO declared an epidemic year, basically everything switches, right? So in these areas now, you actually see an increase in economic activity. You see an increase in child health outcomes. You have like, less stunted children. This is the light blue bar, and you have less underweight children. We do see effects. So Pascaline mentioned this at the beginning. We see some effects which are kind of worrying on crowd out of routine vaccination. So like the kind of child vaccinations around tuberculosis and measles and DPT that you would usually get. In those years that are declared epidemic years, you actually see a decline in total vaccinations to children. So very kind of interesting switching effects when you have this like WHO declares an epidemic year in your country. Why is this happening? So one of the things that we are able to highlight as maybe like one of the mechanisms that might be driving this is that, remember that external financing chart I showed you, right? 20% is a high number. A lot of African countries are kind of getting a significant share of health spending from these external spending sources, like donor spending, if you will. So what happens when the WHO declares an epidemic year is that it triggers an inflow of kind of disaster aid, right? So we can document this with World Bank projects. And I was talking to Albert about this earlier, but this is the kind of data that we have on World Bank projects. And you actually see kind of an increase in the amount of money, dollars committed to health projects and disbursed to health projects, and also just the share of health projects funded during the epidemic years. So this kind of influx, and think of like stimulus money, is like really important for reversing these negative effects of epidemics. And just to show you, these are kind of like the type of programs that get funded. This is World Bank project titles, and you see during epidemic years, you have this economic recovery and adjustment credit is a top title, and health sector programs, versus in a non-epidemic year, the typical health project would be like a fertility, nutrition, health project and community action program, something like that. So really, highlighting that this is like what's a significant part, right, of the story, this kind of influx of donor spending from places like the World Bank, or kind of external funding sources to health. Okay, so the kind of second part I'm going to talk about in terms of the key points, well, running out of time, very briefly, is thinking about, again, Agnes talked about this earlier, really important. Domestic governance has been very key in managing the effects of these epidemics. And I can speak, I can speak from the point of Nigeria. The Nigeria CDC has, did this with Ebola very successfully, has done this with COVID very successfully, implemented contact tracing and information. They've been using a lot of technology. So they're like COVID-19 tracker apps, WhatsApp chat boxes. Testing is low, but that's something that they've been trying to kind of increase, again, based on their experiences with past epidemics, and really supported isolation. So Albert mentioned the large informal sector, ensuring that you have like food aid, free water and electricity for the very poor, investment in sanitation. Countries like Nigeria and Ghana have implemented these policies that have been very key in managing past epidemics and also COVID. Last point on the trust, really important, right? So I don't know if you guys heard about this in the news. There were some protests in South Africa about like, we are not guinea pigs. We're not going to take up these COVID-19 vaccination kind of trials. And people's mistrust is very well based, right? There's been a history of kind of mismanagement and kind of unethical behavior by some companies when it comes to vaccination trials in Africa. And the kind of infamous one in Nigeria is the 1996 Pfizer meningitis epidemic trials, which like killed a lot of children in northern Nigeria and led to like real protests in the streets, right? So how did government handle that? They really made sure to involve local stakeholders, so traditional leaders and religious leaders that people trusted, to say, spread information about the vaccines that we're giving to your children, and say like, we will guarantee that these are not going to be harmful to your children. And really building that trust was very important in kind of getting people to take up vaccination, after the kind of news about the Pfizer trials came out in 2000 in Nigeria. So I will stop there, but just kind of these 3 key points. Thank you.
Thank you so much. So we'll now go on with the Q&A, and there are a number of questions in the Q&A box that I will relay. So a number of questions from a few people, Natalie, Hannah, Alistair, were kind of like pushing back against my provocative slide, saying that Africa had beat COVID, and arguing that maybe it's just not so clear that there are no, few cases. Maybe it's really due to lack of testing undercounting, and so the question is really whether there will be other manifestation of the crisis in the form of like extra deaths that are not being seen but are likely to be happening in remote areas, in villages. So is there any sense that there is more of a crisis than what can be seen? My own experience from being doing phone surveys with various communities around the continent is that people do not report, excess deaths around them, but maybe the numbers are too small to be picked up in such. So I'm curious to see, Professor Binagwa, what your response is.
I think you are provocative saying that we beat COVID. Nobody said that, and even me, I say going forward we need to be careful. But the systematic questioning about, is it true because it's Africa, go in my Western narrative. And all the Black people who are saying that are just colonizing their brain. We don't see more death in hospital. We don't see more death in communities. People doesn't die anonymously. Did you see what has happened to New York? You believe we can hide that? No. Huh? So, that's my answer. That means we have less cases. The cases we have are led less to death. Better do studies and try to see why. Let us do behavioral studies and implementation type of studies and try to see what the world can extract from that.
Thank you. A number of questions also were around the informal sector. Dr. Zoifa, can you tell us a little bit more about what you know of the impact of the crisis on the informal sector? I know the World Bank has been doing a lot of surveys. I've seen impressive, very rapid data coming out of these studies showing like the decline in income that people have experienced in response to the lockdown. Do you have some magnitude that you can share with us? Beyond those you had in your slides?
Yes, let me quickly come back on that first question on beating the odds. I think it's important, as Agnes said, to acknowledge that it's not over yet. We need to continue to be cautious. But it's also important to push back on these constant questioning, as if for some Africa can not do something right. And I think that's something that you see in a certain press. And it's important to also acknowledge when African countries do things right and achieve to say it. So I think that's extremely important. On the impact on the informal sector, the first thing to realize is COVID was an urban crisis first, and most of our informal sector is in urban areas. So most of the collapse in consumption that we see in our modeling and the findings I show is actually coming from those distanciation measures or those lockdown for countries that implemented them. That led to a significant reduction in interaction between people, which is the essence of the informal sector activities. So it was extremely important. Second thing, we've been using high-frequency surveys to document impact on informal firms in Africa. And my office has been looking at especially impact on women in the informal sector. And we are clearly seeing that the number of closure of informal activities has increased significantly during COVID, but that women-led activities, women-led firms in the informal sector are actually being affected more or affected disproportionately. So these are worrying numbers, but we are continuing to collect those data. And it's important to also say the crisis is an opportunity, and the opportunity for African countries to really shift from the traditional or classical way of collecting data to embracing and leveraging the digital. And that's what we're trying to do to assess those impacts. So short answer, the impact on the informal sector was extremely negative. And we hope as countries reopen that it would improve. Thanks.
I wonder whether part of the greater effect on women is the fact that many schools are closed, and so children have to be, taken care of, and that may disproportionately affect women. I guess we don't have a lot of time left, but there was a question about the likely impact of the crisis on flows of foreign aid, and so I was wondering whether Professor Archibong, you could speak to that, given what you've shown us of the fact that aid can really help deal with crises. When the crisis is global, what should we expect?
It's a good question. I mean, this is like we're in uncharted territory. And I guess, Albert, I don't know if you can also, you've been following this and you can jump in on this. From our experience in our research, what we see is that you do see more inflow of kind of health aid, but then you see less to non-health projects, right? So it's kind of there's a trade-off going on where you see an increase in health funding, health aid, but less to non-health aid. So kind of the aggregate effect is like flat. What's going to happen now, and how do we think about kind of donor aid and foreign aid in a pandemic, or when you have this as a global event? We're going to have to see. I know, like, I've been following the World Bank. There was a huge announcement about like stimulus and funding to African countries. That it's like a really, really huge amount that came out, I think, a few months ago. So I think the aid is still happening. A lot of international organizations are still kind of funneling aid to these regions. And again, it's just like especially important for Africa because of the fact that, I mean, we are 20% of our health spending is coming from external sources. The world average is 0.2%. So, these funding sources are going to be very, very important for kind of dealing with the effects of the pandemic.
Thank you. There was another question which I think is very important. I want to make sure we have time for it. It was related to your point, Professor Binagwaho, that there is competition for procurement in supplies. And so one respondent was, audience member was asking, what should we expect when a vaccine is available? What are going to be the ethics of, thinking about who is going to get access to the vaccine first? And, are you worried that when there is a vaccine, it's going to be difficult for countries in Africa to get their fair share of the supply?
That's a reality. We don't expect the people to be better during a pandemic than in usual time. What happened why I noticed that? Take a country, I'm even not going to take a country, I'm going to take Barbados, where the minister complained officially against the US to stolen on the tarmac the respirator procured and paid already. And it's all over that. France did that also against the US. So I think what we need to recognize here, we need to go to new international laws that make the powerful countries to have more ethical behavior. For the vaccine, I believe that the country that will discover a vaccine will serve their people first. But what I know also is that there is a lot of money given by people like Bill Gates. We have Gavi that is involved. We have a lot of entities that say that they will privilege first the people at risk. That means the healthcare providers across the world. So I believe that this is already a progress, and it's the first time the world will have to have such a plan where the international organization and the big fish, the big donors are around the table to make that ethical. If not, it's going to be the jungle, and we know that we don't have laws to protect the people. First thing after the pandemic.
All right. Well,
can I just add something on that answer? Yeah. Which is procurement is important, but we should also, as African countries, seize this opportunity to start producing some of those goods. And that's what Ethiopia is doing, shifting its manufacturing structure that was producing, jeans and suits for the US market, converting that into production of PPE and exporting to other African countries. That's an opportunity. Thanks.
All right. Thank you so much. We are out of time. There were a number of questions that we didn't have time to address. Sorry about that. We'll keep a note of them and then try to send references or resources to address them. Before we close, I just wanted to mention the next, not the next, but one of the upcoming events that we have at the King Center is going to be a conversation with David Miliband, the President and CEO of the International Rescue Committee, on Thursday, October 29 at noon. You can register for this event on our website. Thank you, everyone, and especially our panelists. It was absolutely wonderful to have you and to hearing your views. It's been really insightful, and many more questions have been raised from hearing you. So we hope we have a chance to hear from you again, and that my forecast that Africa will beat COVID will turn out to be right sooner than later. Thank you, everybody, and be well.